Guys, my name is Sarah Steer. I work with Wilmington Health. I am the recruiting specialist over here. Let's see. I'm going to share my screen. Let's just start out by saying happy Monday. Oh my goodness. I hope you guys had a wonderful weekend. Can everyone hear me okay? I'm going to take that as a yes.
Yes.
Okay. So again, my name is Sarah Steer. I'm the recruiting specialist here. I've been with Wilmington Health for just going on about a year. I recruit for all of our departments and for all of our facilities that we have across Wilmington Health. So really at the end, I'll share with you all of my contact information, my email, my cell phone number, and I'm always looking to chat with future candidates or any questions that you do have just about the company in general. Please don't hesitate to reach out to me. But a little bit about Wilmington Health. So it's wonderful to find a company that has a great mission statement and also a great vision. And really, I feel just kind of what I've seen in the past year really kind of sticks with the vision as well. So our mission statement that we have is Wilmington Health is committed to using collaborative evidence-based medicine and providing the highest quality of care to patients that we serve. And our vision is that we aspire to be the most trusted partner in healthcare. We pledge to transform the delivery system. We will continually develop collaborative and innovative solutions that demonstrate quality, reduce the cost of care, and improve the patient experience. And so we definitely have some super exciting things that are coming up, and also that we've just kind of pushed out that really show that we're really sticking with our vision that we do have. So a little bit about Wilmington Health. We've been around since 1971. We also have over 20 locations, and we are growing from there as well. We have multiple departments. I am certainly not going to read through all of these, but these are just a couple that we do have. Overall, we actually have 32 plus specialties. We have 280 plus providers, and we're certainly growing from there. On average, we're recruiting about 4 to 5 providers each month. So Wilmington Health is certainly making our name out here, and also we are growing pretty rapidly, and so we need some staff as well. Some positions that we do have at Wilmington Health, obviously we have such a wide variety. We've got clinical roles, we have the non-clinical positions. For our administrative roles, we have things like patient representatives, we have people who are doing insurance advisors, our billing, our coding, refund analysts, things like that. So we are always searching as we grow. We certainly need these positions to grow with us. Some of our clinical positions that we do have, we've got RNs, LPNs, CMAs, lab assistants, x-ray technicians, and so much more. So really anything that you're going to school for, I promise you there is a position that we could accommodate for. We also have some great management roles as well, things like department managers, we have our directors, clinical coordinators, and I will say that something that I've noticed here at Wilmington Health is we certainly have a lot of growth opportunities. So we are always looking to move people into lead positions or train them to be the next manager. A lot of our current department managers actually started out in RN positions and have really worked their way up and are an incredible asset to our team. So growth at Wilmington Health. So we certainly have a lot of things that are coming up and or have really already started. At the moment, we're building a new ambulatory surgery center, and so that hasn't started quite yet. We do have those plans, and the word on the street is that we are looking to have that completed before the end of the year. Recently, we actually acquired a Penslow Memorial in 2021, so that was exciting. So that's kind of grown our buildings that we've had. Another really exciting thing for our clinical staff is we've actually created a Today's Care Plus facility, and that's over in Wilmington. It's a step down ER, so it's really exciting. It's a little bit above our normal urgent cares, and it's just one level down from an ER. So it's continuously growing, and it's really exciting. We actually just at the beginning of last year, we were able to bring on a bunch of paramedics, and so we were able to really expand the positions that we have within Wilmington Health as well with that. A couple other things that we do have, like I had said before, we've got 32 plus specialties. We've got over 280 providers and certainly growing. Some super exciting things that have been a part of, and I'm not sure if you guys have been able to participate, but recently we've opened up a COVID vaccine clinic, which has been incredible to be a part of in the community, and really seeing people kind of come out and help out with that. With that, we have multiple positions within that department, and we have people who are giving injections, and then we also have people, they're kind of greeting, checking people in. We have people navigating the clinic, bringing people from step to step. It's been a super exciting thing that we've started out, and we are certainly very busy with that, and we continue to get busier and busier. Also, another new thing that's coming in, actually, we're launching it today. We have a new Women's Center of Excellence that's being launched, and so it's a Wilmington Health Center, and it has all Wilmington Health specialties all women's health specialties under one umbrella. And so it's really exciting that we're pushing that out, and we have some wonderful providers that are being a part of that. We're also building up a sports medicine program. And so we have a lot of things going on. And of course, the one big thing that I really love is we've recently launched a True Care program. And I think that that's really sticking with our vision, where we have a great patient experience team here at Wilmington Health that's always looking to improve that experience for the patients that we have, and also in turn really create a wonderful workplace culture for our current staff that we have here. Some wonderful things for Wilmington Health benefits that we have. Of course, here at Wilmington Health, we have awesome hours. So most of our offices are going to be open Monday through Friday, 8 to 5. So you do get that great work-life balance. We also have tuition assistance, competitive benefits, annual bonuses and incentives, 401ks, start accruing PDO on your very first day of employment. It's a great family environment. I mean, the teamwork here is incredible. You have such a great staff that you work alongside. It's really great to be a part of. And like I had mentioned before, there's some excellent internal growth opportunity. You get discounts for coming to Wilmington Health as an employee, so you get special rates to see our providers, discounts on Botox, things like that. So all in all, I do have to say, obviously, we are hiring. The application process is very simple. Our website's wilmingtonhealth.com/careers, and we always ask that you submit an application. I provide you my email address and my cell phone number. Really, truly, I mean, I always kind of want to hear from you guys and talk to you about what you guys are looking to do and kind of point you in the right direction as to where would be the great growth opportunity for you. I always submit a resume. If you have any questions about our applicant process or even your resume, I mean, I work really closely with a couple of the schools out there, and I have people sending me over their resume and kind of asking for advice to, what changes that they can make. It's not necessarily just about working for Wilmington Health, which, I mean, obviously we would be more than excited to have you in here, but it's really about our community that we have out here in Wilmington and making sure that we have the best staff in the best places that we have out here. So I would love to hear from all of you guys. If you have any questions about our process or our application process or departments that you're interested in, please take down my information. I would love to hear from you guys. Does anyone have any questions? An application for a process for our CNAs. We are currently hiring for some CNAs in some of our departments. And so if you head on to our website at wilmingtonhealth.com/careers, there is a posting up there for a CNA. You'll notice on our website, we have a lot of very generic job descriptions up there for CNAs, for CMAs, and LPNs and RNs, and often I don't have the specific department listed in there. Really, I like to cater my interviews, so once I see that application, when we schedule an interview, we talk about the different locations, because obviously with 22 different offices, I want to know what area you guys are looking to work in, based off of where you guys are living, and we go over the departments that are currently hiring for that role, and we talk about, what you're most interested in. Obviously, we feel like you're going to get the best longevity if a candidate is in a department that they're passionate about. So we don't want to just kind of shove you into a department just for the sake of being in our company. We want to make sure that it's a great fit. So if you submit that application on our website, when we're doing our phone interview, we'll talk about what you're most interested in and see if we can set you up with a manager to talk with them a little bit more about those positions as well. Absolutely. Any other questions? All right, perfect. Well, thank you guys so much for letting me present today. I really do appreciate it. I really hope to see some of you guys come through on our applicant tracking system. And like I said, please don't hesitate, even if you're not going to submit an application, if you have any questions or if you want to know kind of what we have, what departments we're hiring for before you submit that application, email me or call me. If you text me, I always ask just to put your phone number so I know who I'm talking to, your name in there. And, you know, I really hope that you guys kind of take a look. We would love to have you part of our team. And of course, best of luck with the rest of your career.
Thank you so much, Sarah. If you want, you can hang around and wait for the other presenters to finish up. I'm pretty sure that some of our staff members may have additional questions about the application process as well.
Absolutely. Thank you.
So our next presenter will be Deborah Cottle from the Telecommunications Center. So Deborah, why don't you start by telling us a little bit about yourself, your current position, and then you can talk about the recruiting process.
Okay, can you hear me okay?
Yes.
Okay, great. Thank you. Good morning. My name is Deborah Cottle. I'm the manager of New Hanover County 911 Center. I've been with New Hanover County for 32 years. I started out as a telecommunicator, and I'm hoping that everyone listening to this today may consider this as a lifelong job that you might want to be a part of if you don't want to be on the street where people are shooting at you or running into a hot burning building or having to touch someone with their body parts loose or hanging out. This is the perfect job for you. New Hanover County answers just over 500,000 calls a year. This past year we answered 548,721. So our position here at New Hanover County is that we bring you in, we teach you all the things that you need to learn about processing a call, how to handle a call, how to handle yourself during a call so that you can do what you need to do. A lot of people think it's just coming in and talking on the telephone, and it's not. So it takes about a good year for you to come in and be able to do this job and do it well. So whenever someone's interested, we can take you as young as 18. We do find that there are some very mature 18-year-olds out there. There's a lot of training that you get, a lot of certifications that you'll obtain within that year. So if we do bring you on at 18 and we're trying to help you grow and mature into a full-time position with us, this is an excellent job to help you do that. It can be a stepping stone into law enforcement, fire department, or EMS. Whenever you decide you want to come and work with New Hanover County, again, our center is a 21 position center, meaning that at all times we try to keep between 16 to 21 members on staff. For the phones that may ring, it depends on what day of the week it is, what week of the year it is, the summertime versus winter time. So the call volume fluctuates, so we staff accordingly. For New Hanover County, we want people to come in with a good mindset that we have 5 core values that New Hanover County really looks for in staff. And that's professionalism, integrity, innovation, stewardship, and accountability. And if those 5 things are present, then you've already got a good head start on showing us that you're going to be an excellent telecommunicator. Telecommunicators need to be able to do multiple things at one time. We're seeking someone with extremely strong typing skills, and we know that our generation today out in the workforce is really good with telephones, little cell phones, but we need you to be familiar with the keyboard as well, because everything that a telecommunicator does is typing into the system. Your caller is telling you, you've now got to take and put those in clear words for the person that's dispatching on the radio, so that the field units know exactly what they're going to before they arrive. So we're looking for strong typing skills. We're looking for excellent memory recall, because sometimes in these stressful moments, our callers will blurt out a whole bunch of information at one time, and you've got to organize it. So if we're talking about someone that stole something, we want to know what the person looks like. We want to know what they stole. Did they leave in a vehicle? Not so much as what door they come in, and did they walk around, and did you see them talk to someone else? So we've got to organize our story so it's very understandable to the person responding. Again, you're going to do multiple things. You may be taking a phone call at your console, and someone else is taking a call that needs to be dispatched by you. So you may be working the EMS console, and you're taking a law enforcement call when a call drops into your computer. So you're going to learn how to do 2 to 3 things at one time. We use what's called an automatic call distribution. It gives you a little beep in your ear to let you know that the next phone call is coming to you. It gives you a chance to wrap up whatever you might be saying or typing. Being able to be enthusiastic about the job that you're doing, we want to see that every day, because we have 230,000 plus citizens that are guaranteed that somebody's going to be here at work when they call. And since we don't know when that's going to be, we've got to make sure we have the staff here. You need to be supportive and caring, but you also got to understand you may never get closure to the call that you just took. You've got to be okay with that. You got to know that that moment you handled your call and you did it well to the best of your ability. You used your training, your skills, and you handled that caller just like you would have if it was someone that you knew. If you would like to be a part of this, and you like multitasking, and you like fast pace, stop and start and pick back up, and you really want to be in that kind of environment for 12 hours, it is 12 hours we work, and we rotate through the consoles. If you're interested, go to the New Hanover County, and it's nhcgov.com. That's our county webpage. And at the top of the page, you'll see where it says New Hanover County Departments. Look for Human Resource. Go all the way down to the middle of the page, and you'll see where it says Employment. Click on there. You can upload a resume or a cover letter. Again, we're looking for all those skill sets that we told you about, typing and memory recall. When you submit your application, it'll go through the first process with the Human Resource Department, and they'll say, hey, they cleared this initial, here's the applicant. So we take and we give you a 2-hour pre-employment testing. That does seem a little bit long, but it's testing 14 different categories. Out of that, once you pass that, we'll look at that and make sure your typing skills are on target, that you were able to put all that information together very quickly and handle multiple things at one time. Then we're going to do a phone interview with you. If you pass your phone interview, then we're going to do an in-person. If you pass that in-person, then we're going to have you come in, sit with us for 12 hours so that you can see what you will be doing if you're selected for this position. And then from there, we'll do another in-person interview and then bring you on board. Again, your training is could be anywhere from 9 months to a year to get everything up under your belt, but you'll be certified through the International Academy of Emergency Dispatching for police, fire, and EMS. You're certified through SBI, State Bureau of Investigations, for Division of Criminal Information. It's a wonderful job, but again, you got to be willing to talk to strangers that you'll never ever meet, be able to close one call out and go on to the next and never know exactly what happened. It's a fabulous job. I couldn't recommend anything better for anyone. If you want to be a part of this, please reach out to us. Again, it's nhcgov.com, or you can call me. I'm the manager at 911. My name is Deborah Cottle, C-A-T-T-L-E. You can reach me at dcottle@nhcgov.com, and I'll be glad to answer any questions. This is your 911 center, and we'd love to have you come, one, be a part of it, two, come and see what we can do for your friends, family, before and during, after an event. Thank you. Does anyone have any questions for me?
All right. Thank
All
you.
right, I look forward to hearing from you. Thank you.
Thank you, Deborah. Cindy has something in the chat. She said, thanks for suggesting possible academic pathways. Yes, it's definitely something that we encourage here at Cape Fear. You know, you might start out in a specific area and you may be able to transition within that particular organization or company. So that's always really important. So thanks for pointing that out, Cindy, and thank you for sharing that, Deborah.
Thank you.
All right. Our final presenter for this presentation will be Grace Cahill with New Hanover Regional Medical Center. So Grace, I'll turn it over to you. I'll let you tell a little bit about your current role and what you do for New Hanover Regional Medical Center and what you look for in the application process.
Thanks, Deshay. Can everybody hear me okay?
Yes.
Awesome, thank you, because I was definitely going to not talk until I heard feedback, so that's excellent. So I'm going to go ahead and share my screen, which I've never done, and collaborate, so this is going to be an adventure. Okay, I think I'm sharing my screen. Hang on. My entire screen share, or we can just say application window. I think this is going, pretty well so far. Okay. Let's share my deck. Can everybody see my screen?
Yes.
Yes.
Excellent, thank you. Okay, so let's start from the beginning. My name is Grace Cahill. I am a recruiter and you really do have to take a good deep breath before you say Wilmington Health, New Hanover Regional Medical Center, LLC. So I think it's a good place to start with. You may have heard we are in the process of partnering with Novant Health. That is a partnership that began on February the 1st. So we're slowly but surely integrating, and they're learning something new about us every day, and we're learning something new about them every day. So I don't know long term what our name is going to be, but for right now, that is what we go by. And as you can see in the top right corner, we like the image of a bridge because we really are kind of partnering with a really great organization. So a little bit about the organization there. And like I said, my name is Grace, and I am one recruiter of many. We have, I think, 7. We have a lot of recruiters, I'll tell you. And so each recruiter has their bucket. So I will go over big picture, all the areas in the organization, but I can just transparently only really, really well speak to the ones that I hire for. So, or I guess I should say recruit for. So let's move along. About us, so here is, you'll learn just a little bit about Novant's mission, vision, values. We exist to improve the health of communities. We deliver the most remarkable patient experience, and we are human-centered, world-class care, access for all, and purposeful innovation. So we have won some awards, which is great. Obviously not what we do it for, but it's great to be recognized as one of America's best large employers. And just in the Wilmington area, prior to the partnership, we were the largest employer. So just a little bit about us. We hire for a lot of jobs, and don't worry, I will not take everyone through the dirge of reading every single solitary position on this slide, but my coworker, colleague Rachel, and I really just want to provide a high-level overview for y'all of all of the many different kind of functions of this organization. You know, you think of the hospital and you don't necessarily think of, oh, spiritual care or marketing, but we have, you know, support functions as well as business functions, and so it's actually, we've got a lot more, I think, than meets the eye, especially when it comes to healthcare. So just, I mean, we've got nursing, allied health, non-clinical, and professional. And I will tell you, I share the non-clinical and professional positions with my colleague, Rachel Quadlow. So when asked to explain some of the education skills and strengths we seek in an applicant, I was actually working on a project not too long ago where we compile information on each of our business units. And so one of the questions we ask our leaders is, you know, describe for me your ideal hire, describe for me your ideal applicant. So I've grabbed verbatim some of the things that managers have told me. And again, I will not have you read them all, but I will tell you my main takeaway is skill set is important, but mindset is equally as important. So you may be the best CNA, the best medical assistant, you may know, you know, everything cold, but if you are never on time and you are, you know, unhappy to be at work every day, it's just that will impact, you know, your performance in that position. And so we really look for somebody who's got that really nice combination of mindset and skill set. So we like positivity, and I mean, like I said, we're patient-centered. So I mean, the patient's essentially your customer. So customer service is kind of our MO. The application process I wanted to explain through pictures because I'm visual, so I hope you are too. The first picture is of our website, so NHRMC or careers.nhrmc.org, but if you just Google like NHRMC jobs, this is what will come up, and you can search, you know, anything from medical assistant to finance to IT to whatever your program of study is, to see if we have a position that you may be a fit for. And then the second photo represents likely, if you are a fit, the manager for that position will reach out to you and would love to have a conversation with you about their role, their team. I assist with all the physician group hiring that's non-nursing, so I don't do RNs or LPNs, but I have all the front office positions. And each physician group is so different. So they'll definitely have a conversation with you about their role and what they're looking for. And then lastly, I picked a photo of an interview. So, and again, that can be your Zoom interview, which I know is pretty prevalent these days, you know, or socially distanced, masked up kind of interview. So in some way, shape, or form, you'll interview for the role. And then from there, the manager may select you as their applicant of choice. And then hit the next button. Oh, there you go. Okay, so the application process as it relates to resumes and cover letters, this is something Deshay and I were talking about the other day, and I kind of really wanted to draw attention to it for people who may be watching this in the future, this webinar. So I've selected a photo of a medical assistant to say that if you are in the medical assisting program, which I hope you are, because we're always trying to hire medical assistants, you want that to be reflected and really clear on your resume. You want any internships you may have to be on there. You want any classes relevant to that even. You just really want to make it very clear that you do have experience with medical assisting, because if you're in the program but you don't list it, we actually have no way of knowing that you have the skills that we are needing. And so I juxtaposed that with a photo of a fundraiser, because I also recruit for our foundation. And I mean, if you're fundraising, your resume should look very different from that of a clinical or a, you know, for example, medical resume. Whenever you're submitting an application, if you can just have it leap off the page at a recruiter that you do have the skills that they're looking for, that definitely gives you an edge over all the other applicants potentially. I've not looked it up recently. I'm sure Cindy, Deshay, and Patrick know off the top of their heads, but I think a recruiter spends about 6 seconds looking at your resume. So you just want to make that super duper clear. And then industry trends, I just kind of, I threw a couple out there, and largely just to say in the bottom right-hand corner, you'll see an image from our podcast. So we have a podcast called Industry Insights, and if you want to stay up to date on all things Novant Health and in healthcare industry, we fully recommend that you subscribe on wherever you get your podcasts. Today we're talking about the last three, the increased potential price transparency and the implications of that for healthcare, increased resources for public health globally, and as I'm sure you can predict, increased energy around pandemic response. So that was the topic of the most recent podcast. And I included some references. So that is my spiel, and I'm not sure if we have any questions, but if we do, I'd be happy to answer them. No questions. I'm totally okay with that. Oh, you're welcome, Cindy. Resume information, and obviously you should go to the career development office because they will be able to help you with your resume and help you get employed. Cannot recommend that office enough. All right, well, thank you all for your time.
Thank you so much, Grace. Does anybody on the session have any questions for any of our presenters today? Well, I don't see anything in the chat box, so what I'll do is I'll include my email. I have contact information for all employers who are on the call. So if any students have any questions or concerns, feel free to reach out to me, and we will make sure that we can get you some assistance in addressing any of the questions that you may have. Again, thank you so much to our employers who have presented today, for taking the time to share expectations and things that you look for within the interview process. That's going to be really helpful for our students in preparing them to go into the workforce.